Thank you so much. So my name is Kirsten. I am operations director of a company called Diverse Conversations. Diverse Conversations partners primarily with large multinational companies, large corporations. I have lost connection.
We have you loud and clear. Okay, she might not be able
Oh,
to hear us. Yeah, we
yes,
can
sorry
still see
about
you.
that. My
No
phone
worries.
connected to the headphones by mistake. Yes, so we partner with corporations to transform their businesses, primarily through accredited learnership. So we also do a host of other trainings as well. We focus mainly in the healthcare industry. We are branching out, and it is a very fun experience. My background is in public health, largely focusing mainly on HIV and cardiovascular disease, with, as you can imagine, a very large immunology component as well. So a lot of the understanding of cancer branches starts off with understanding immunology, the role that we have in maintaining our own health, our own wellness, from a public health point of view as well. You know, we as women are we do take charge of our own health to an extent when there is access. If there isn't access, what problems arise then? And
Mm,
with cervical cancer, the main preventative tool is actually screening. Something like breast cancer as well, which we discussed previously, also
mm.
screening tools available. But with cervical cancer, it is, yeah, it's an ongoing conversation that we as South Africans are working towards solving.
Excellent. Thank you so much for that. So for everyone who is hearing of or about Lady Liberty for the first time, you're probably wondering like, who is Lady Liberty? Why cervical cancer? Why are we here? Why do we care? So we're a nonprofit organization that is really just centered on the wellness of women. We do have male clients. I always say some more often than not. However, the core of our work is looking into the wellness and the overall health of women. We started off focusing on gender-based violence. The sun is doing something here. There we go. Started off focusing on gender-based violence, marriage, and divorce, and we still do that. So we provide legal information as well as services, including representing our ladies in court matters, mediation, etc. And then over time, there was the stark realization that we cannot deal with the law in isolation. We need to look at the whole person, the whole woman. And this is where the Lady Liberty started to spread its wings. And we now focus on issues such as accessing safe spaces and shelters for the women dealing with gender-based violence. We look at trauma counseling and therapy, working with partners who are already doing this so that we don't reinvent the wheel. And we also look at helping women to get on their feet, because research shows that most of the women who are abused are really financially dependent on their abusers. So in a nutshell, that's who Lady Liberty is. Why cervical cancer? Well, we also look at physical health of women, and January is or was, as January is coming to an end, Cervical Cancer Awareness Month. So we're about to launch into the discussion, and really grateful to have Kirsten here. We had an event last year in Orlando and Soweto where we touched mostly on breast cancer. It was October, which was, of course, Breast Cancer Awareness Month. And so today we're looking at cervical cancer. But let us know, share your information after this webinar if you'd like to be part of conversations like this. Sometimes it's face-to-face. Sometimes it's fun in the sun, yoga, some exercise. Other times it's more painful and thorny issues with lawyers and therapists and counselors. So we are really looking at all of you. And thanks again for joining. So Kirsten, let's jump into it. What is cervical cancer? What is HPV? How do we look out for symptoms or signs? Who's most prone? I mean, take any of those
Mhm.
questions as you deem to get us started. And I'll interrupt as we go just to keep us engaging. If anyone has any questions, please pop them in the chat. And we have amazing support who will just then ping me and we can ask Kirsten while we have her.
100%. Okay, thank you so much, Sam. Thank you. So, cervical cancer, if I could ask questions of the floor, now that we have the Q&A available, I'd like to know just quickly, as I'm busy talking through this, what is your understanding currently of cervical cancer, and who do you think are the people who are most at risk? From my side, I'll start with what HPV is. So the human papillomavirus is it's a large group of viruses. I think it's about 200 viruses, and they once you've been infected with them through exposure, usually bisexually, it's usually sexually transmitted. Once you've been infected by it, it can lead to cervical cancer, and it can lead to esophageal cancer as well. So the idea here is that if you've been exposed, it doesn't necessarily mean 100% that you will develop cervical cancer, but it can increase your risk. So there are factors that are associated with increased risk of cervical cancer, and the biggest one that I've come across is the increased amounts of sexual partners. And we all know that some people have the luxury of staying with one partner throughout their lives. But other people, more than likely, you will have more than one sexual partner. And hopefully there is safe sex involved, but that's not always the case. Not everybody has the access to participate in safe sex all the time. That being said, increased number of sexual partners, also a lower age to first period, so lower age to menarche. And that thing of, oh, becoming a woman, all these womanly responsibilities now, and what else does that entail? And without the fundamental understanding of, your developed frontal lobe and having autonomy over your own body, people telling you, oh, you're a woman now, you must be doing X, Y, Z. Oh, you're grown now, this is what you need to do. Oh, if you love me, it doesn't matter if you're young. If you love me, this is what you'll do. And that increased exposure increases your risk to being exposed to your high risk HPV strains.
Right.
So,
sorry,
yes,
can I jump in?
Yes.
So, if I bring it back, so thank you for the engagement. Also thanking myself for the question, because I was a little bit shy to ask, but I asked it anyway. So, thanks for the intro. Am I understanding correctly that the exposure is only through sexual encounters, or are you saying it's higher because of sexual encounters? Or can HPV, the virus, sort of infect a woman even without a sexual encounter?
It's a very good question, and I will make sure I choose my language correctly, because it is spread through skin to skin contact. And it's primarily through sexually transmitted infections in South Africa. And yeah, we can acquire it through other means.
Okay.
And I will get back to you in a few minutes as to exactly what those other means are. I was focusing primarily on sex.
No problem. Okay, thanks for the comment, Busi. I see you have zero understanding of cervical cancer. It's okay. Most of us do not, so please don't hide. And thanks for joining. Please carry on, Kirsten.
Sure thing. So I am going to go through the comments now. I have zero understanding of cervical cancer, to be honest. That's fair. And can a person get cervical cancer without? Okay, that was the question.
That was me. You can ignore that now. Thank you.
I thought there was another comment, but there was another one. So cervical cancer, may I please show? This is really nice that you're displaying the signs and I'm here talking through it. So this is an image of what the cervix looks like. Am I able to?
We're still seeing the definition. Support, please help us out and go. I think it's there was a slide.
Slide 8,
yes.
please.
Slide 8, please. And I'll support you with the comments and the questions, so don't worry. You can just shoot through, and if you allow me, I'll interject from time to time.
100%. What slide is displaying now, please?
There we go. We can see. Yes. Ooh.
Okay. You can see.
We're seeing the one with the fallopian tube, the ovary. Yes. Please just take us through even just this.
100%. 100%. Okay. So as you see in this image here, I'm not too sure if I can share my mouse, but I'll talk with my hand. It's okay. Okay. This is what we're looking at, is the internal female reproductive system. Mm-hmm. So on the far right-hand side, there's a little, oh, there we go.
Yes, we see the dot.
We can see a dot.
We see the red dot matching with everything, I must say.
There we go. So on the right-hand side, we can see, on the right-hand and left-hand side, on the edges of the image, we can see the fimbriae, that's the finger-like projections that's around the ovary. They go down into the fallopian tube, into the uterus, and the uterus ends there at the base of the cervix. Mm-hmm. So there's your cervix just there. Below the cervix, we can see the vagina, and the vagina then takes us out to the exterior environment. And I didn't display an image of the exterior female genitalia because we're focusing on the internal here. Mm-hmm. So if we look at the zoomed in image on the left-hand side, we see the transformation zone showing the position of abnormal cells.
Mm-hmm.
So if you look at the base of the cervix, just there at the bottom, the cervix ends with vagina, the vagina begins, or the vagina ends where the
Mm.
cervix begins, and everything after that, you're now entering the uterus.
Okay.
So when we consider cervical cancer itself, it starts just there at the junction between the uterus and the vagina, where the cervix is. And typically, when we do a pap smear, we are
Mm.
testing for those cells. And so over here, as the image says, transformation zone showing the position of abnormal cells. When you do the pap smear, as uncomfortable as it may be,
Woo! I was
you,
about to say,
yeah.
yeah, no. Please tell me what exactly are they scraping? Sorry, like we're
Mhm.
talking about the pap smear and the discomfort, the area that you're zoning in. What are they scraping?
So they're scraping the cellular tissue just there at that margin.
Okay.
And for some people, it can be extremely painful, but there would be other underlying issues as well that we're not necessarily going to go into here.
Okay.
For discussion purposes, sex as a whole should not be painful. If sex is painful, please speak to your doctor.
Okay.
You should not have bleeding outside of your menstrual period. Something else might be going on. And with the pap smear, we're checking to see the abnormal cells. If there
Okay.
are any abnormal cells present, I'm going to go one slide back. Okay, so on the far left-hand side, this is the normal cervix.
Mm-hmm.
Thank you so much. Normal front view, you can see the uterus, cervix, vagina, and there are different stages of cervical cancer as well. So if you go for a pap smear and we check in the cellular tissue, it's looking fine, it's looking well. And I say I know you, like in my past life, I used to work in a lab with those days. Oh,
Okay.
I like being in the sun. So in a cervix without cervical cancer, this all
Mm-hmm.
the cellular tissue will be normal. There'll be no abnormal growths. And but if as soon as you start seeing some changes, it might not necessarily be cancer yet. It might
Mm.
just be abnormal cells.
Okay.
If there are abnormal cells present, then you check again in maybe 3 months, 6 months. It could also just be an infection that caused the abnormal cellular growth or cell division.
Okay.
In the case where the abnormal growth is indicative of something else, then it warrants further testing.
Right.
If the cells come back as positive or as cancerous cells, then they need to determine what stage it is. It's stage 1A, stage 2, stage 1B, and it progresses as the numbers increase. And at stage 1, stage 2, let's
Mm.
focus primarily on stage 1. So these two images in the middle, early stage 1, late stage 1B, stage 1B. So
Mm-hmm.
this is cancer only in the cervix. And if you look at the bottom images, you can see in early stage 1B and late stage 1B, the
Mm.
cancerous tissue is confined then to the cervix itself. But as we progress to higher
Oh,
stages, you can see how the cancer itself starts spreading now up to the uterus, could be in the vagina as well. And we also have lymph nodes quite close in that area.
yeah.
And if the cancerous cells spread into the lymph nodes as well, it can move to other parts of the body. And then it's a different cancer stage.
Okay, can I ask a question in terms of the
Mm-hmm.
progression? So first of all, I must say it's already quite scary. Maybe it's just me. I might have some related trauma, but just hearing stage one and then like
Mm-hmm.
a later stage, it obviously talks to a progression of sorts. Is there like
Absolutely.
a general time period where the stage sort of evolves? Is it person dependent? Are there other factors that influence the sort
Mm-hmm.
of speed of this? Or yeah, can you just talk about that bit a little bit, the progression?
Those are very good questions. And I'm going to make a note of them because I don't want to forget anything.
Oh,
So
yes.
please,
Okay,
can
for
you write
later.
it down actually, just so I
Okay, I'll
make
put
sure I
it in the
cover all of your
chat.
points? So staging is how cancers as a whole are determined, the severity of the cancer, how far the cancer has spread. Is it confined to one location? Is it spreading to other locations within the body? And hopefully we get to a point where we prevent the cancer from progressing before it even gets to stage 1B. Hopefully we find it early enough with our pap smear. And we can discuss